now going on to talk about the vulnerability and the reasons why some people are more vulnerable than others. These are some of the risk factors that have emerged from empirical research as predictive of problematic bereavements. You wouldn't be surprised that dependent people have problems when they lose the person they've been dependent on. What is not quite so obvious is why it's often the weak one who dies and the strong one who breaks down. And I think that reveals the extent to which our love relationships are often have a measure of both, or they are mutually rewarding. The big strong man relies on the little wifey to reassure him about his strength and magnificence and so on, and without her he becomes just as helpless as she would have been. So these are collusive relationships from which each gets something, but they give rise to problems when they come to an end. Ambivalent relationships, you might think that if people didn't get on well with their wife or their husband, when the person died, they'd breathe a sigh of relief and go and marry somebody else. But life isn't that simple. As long as people stay together, there's likely to be something holding them together, an attachment. And there may be both love and hate in that attachment, which then continue after the bereavement. For instance, I knew one lady, I saw her a week after her husband's death, and she said, "I don't know why you're including me in your research. He was a dreadful husband, I shan't miss him." And she described how he was an alcoholic, and she had to bring him home from the pub every night. And she said, "I left him 5 times. The fact that she'd left him 5 times indicated that she'd gone back to him 5 times. And there was clearly something that was holding them together. And the interesting thing was, when I went to see this lady again 3 months later, the situation changed completely. She looked very distressed. And within a few minutes of my arrival, she was saying, "You know, if I could find another man just like my husband, I'd marry him tomorrow." I couldn't believe my ears. I said, "I thought you didn't get on with your husband." Well, he said he was a bit of a naughty boy. And I realized that this monster who'd been out to destroy her had shrunk to being a naughty boy. She'd somehow changed her whole image of him. I suppose very often when we have a conflicted relationship, one way of dealing with it is by monsterizing your partner. And as long as they're alive, they are the monster who's out to destroy you, and you can hate them. Once they're dead, you can't do that anymore, and you become more and more aware of how much you miss them. And this is the point where perhaps one gets a rather different view of this person. It's not surprising that both anger and guilt complicate the course of grieving. We've talked about inhibited reactions. They're difficult to study, mainly because there is no one's developed a very satisfactory way of deciding when someone's having an inhibited reaction or when they're just absence of grief because they weren't very attached in the first place. And this has led some researchers to reject the whole concept of inhibited grief. I think as a clinician, I recognize that where people acknowledge that there has been a relationship, particularly if they're consciously attempting to inhibit their grief, you then become attuned to the possible consequences of that, which include things like psychosomatic symptoms, mysterious aches and pains, nightmares, difficulty in sleeping, unexplained depressions, things like that, which seem to reflect an unresolved problem in the grieving process. Low trust in self and low trust in others are, I believe, integral to a lot of our problems in life. Perhaps the 2 most important things that we learn from our parents. And I have more to say about that in a minute. obviously a history of previous mental illness or suicidal threats is likely to be a risk factor. I've found working with, say, nurses in a hospice setting, they're often reluctant to ask about this. They feel they're intruding when they ask questions of a family, anyone in your family that you're worried about who might be a suicidal risk. In point of fact, when there are such problems, people are eager to talk about them. I find time and again, once we indicate to the family that we are actually interested, that they can tell us about any problems. Even asking a question like, is there anyone in your family you're worried about? Anyone who might react badly to your husband's death or whatever. You soon become aware of which members of the family are most at risk. Maybe the children, maybe my wife who had this terrible depression 5 years ago, and I'm frightened when I die that she'll maybe kill herself, and what will the children do without her, blah, blah. You can see the sort of problems. Once you open the door, people will walk through it. If you don't open the door, they won't. The basic assumption is that it's the patient who's being looked after and the family don't have any rights to care from us. And I think we have to take some sort of initiative indicating that that's not necessarily so.